So good morning, I'm Dan,
I'm Grace. I'm Sabrina.
and we're going to present ultrasound technology. It's going to be based most on how ultrasound is used in pregnancy, but I'm going to first start off going over the discovery and the historical development of ultrasound, and then what the modern ultrasound looks like, and then how to do a basic interpretation of the one that's most commonly used. And so I'm just going to orient you to a typical picture that you're going to see when Grace presents. But this is a B-mode scan. The transducer is up top, and this is the first layer of skin that the ultrasound waves hit. This little symbol here indicates that the transducer is facing forward, and in a typical technique that doctors use, they're going to have that transducer pointing either to the head of the patient or to the patient's right side. And so this part of the image will be towards the patient's head or the right side, and then the other side is going to be towards the patient's feet or the patient's left side.
Okay, so an obstetric ultrasound is the use of ultrasound scans during pregnancy, and it uses a real-time scanner, and like Dan said, the images are emitted from a transducer. So there are many reasons for an obstetric ultrasound as listed below, and I'm going to go through each reason, starting with the diagnosis and confirmation of early pregnancy. So markers viewed for early pregnancy are a gestational sac at 4.5 weeks, the yolk sac at 5 weeks, the embryo at 5.5 weeks, and a visible heartbeat between 6 to 7 weeks. And if all of these markers are viewed, the probability of continued pregnancy is 95%. All right, so here we have the gestational sac. It's this black fluid-filled circle, and a gestational sac is the large cavity of fluid surrounding the embryo. And then here we have the yolk sac, which is responsible for providing nourishment to the embryo. So we have the gestational sac with the yolk sac in the center. And then here we have an embryo at 6.5 weeks. So these arrows are pointing to this white kind of line. That's the uterus. And then we have the outline of the gestational sac with the embryo here, this little circle, and the yolk sac attached here. And then here is a visible heartbeat at 6 weeks on one of the Doppler ultrasounds. So next is the determination of gestational age and assessment of fetal size. So there are measurements made for these determinations. Some of the measurements are the crown to rump length, the biparietal diameters, the femur length, and the abdominal circumference. And the size and growth of the fetus can help diagnose intrauterine growth retardation. So first is the crown to rump length. So this measurement is made between 7 to 13 weeks, and it gives an accurate estimation of age and is used to determine the due date. So again, we have the outline of the uterus, and then the outline of the gestational sac with the fetus in the middle. And this measurement starts at the top of the fetal head and goes all the way to the fetal rump. And so if the fetus was 2.7 centimeters, the doctor would say that the mother is 9.5 weeks along. So they would add 30.5 weeks to that and then give the mother her due date. Next is the biparietal diameter, or BPD. This is the diameter between two sides of the head, and it's measured after 13 weeks. It increases from 2.5 centimeters at 13 weeks to 9.5 centimeters at term. So this is a cranial ultrasound. You can see the outline of the cranium, and the biparietal diameter starts at this side of the head and goes down to this side of the head, which is shown with the dashed line. And then here on the graph, this line represents the 5th percentile for measurements. The middle represents the average measurements, and the top line represents the 95th percentile for measurements. We have to keep in mind that these graphs are just for visual representations. All of this information is actually integrated into the ultrasound, so doctors have all this information with the click of a button. So next is the femur length, or FL. This measures the longest bone in the body at 14 weeks, and it increases from 1.5 centimeters at 14 weeks to 7.8 centimeters at term. So here you can see this is the leg of the baby, and here's the femur, so that it starts here and the measurement goes to here. And femur length also is often used in aiding for the diagnosis of dwarfism, because a sign of dwarfism is shortened limbs. Doctors do have to consider when diagnosing dwarfism, though, the stature of the parents. So a lot of times they'll use limb measurements with protruding of the forehead or a lack of a nasal bridge for diagnosis. And now we have the abdominal circumference, or AC. So this is the most important measurement made in late pregnancy. It reflects the fetal size and weight rather than age. So weight of the fetus is often found using a polynomial equation containing the biparietal diameter, the fetal length, and the abdominal circumference. So to orient you to what you're looking at, if you were to draw a line across your abdomen and pretty much cut yourself in half and you were looking inside, that's what you're seeing here. So this is the baby's abdomen in a cross-section view. So this faint yellow line going around is the abdominal circumference. All right, so next is the diagnosis of fetal malformation. So abnormalities in the fetus can be often diagnosed by ultrasound before 20 weeks. Some common abnormalities are hydrocephalus, anencephaly, congenital heart defects, spina bifida, cleft lips or palates, and exomphalos. So first is hydrocephalus, which is a buildup of fluid in the brain. So this is, again, a cranial ultrasound, and you can see there's these 3 ventricles that are black inside to represent blood flowing through. And on this side, you can see the 3 ventricles, but these are bigger ventricles in comparison to these. So once hydrocephalus is diagnosed, the mother can still go through a regular delivery, but sometime after the baby is born, doctors will go in and implant a shunt into the ventricle in the brain, and it will drain down into the stomach. And unfortunately, 50% of these shunts in pediatric cases actually malfunction within the two years, so somebody with this diagnosis can expect to have neurosurgical procedures for the rest of their life. Next is anencephaly, which is when a baby is born with an underdeveloped brain and an incomplete skull. So here we're looking at the baby's head. You can see the mouth, nose, eyes, and outline of the head. And then here we have the mouth, nose, eyes, and then you can see the absence of a complete skull because of the underdeveloped brain. So when this diagnosis is made, unfortunately, there's nothing that doctors can do. This baby is considered lethal, so it gives the mother 2 options. She can either abort the baby in utero, or she can wait and deliver the baby at full term, but oftentimes they either end in a stillborn or the baby only survives for a few hours. So next is congenital heart defect, which is an abnormality in the heart that developed before birth. So on the right, we're looking at a heart ultrasound. We have the left atrium, left ventricle, right atrium, and right ventricle. And on this one, we have the left atrium here and the left ventricle, right atrium, right ventricle. And when looking at this heart, you can see it has a consistent rhythmic look, while this one has a very sporadic look. And you can see the clear indentation in this side of the heart, which is a diastolic right ventricle collapse. So oftentimes when kids are diagnosed with congenital heart defects, they go through a regular delivery, but then they're expected to have surgeries throughout their life. Oftentimes they place shunts in the heart, and then those kids have limitations the rest of their life concerning physical exertion, so they don't overwork their heart. So spina bifida is a birth defect in which a developing baby's spinal cord fails to develop properly. So here, on a regular spinal cord ultrasound, we have the spinal cord running, or not the spinal cord, this is the spine with the spinal cord behind it. And on this ultrasound, we have a continuous spinal cord or spine here. And then here behind it is the spinal cord, but it stops here, and you see this black protrusion, which represents a protrusion of nervous spinal cord tissue and fluid. So when this diagnosis is made, the mom is expected to have a C-section to prevent any pushing on the protrusion, and then the baby will have to have surgery to fix it. Depending on the size, the kid may have one surgery and then live the rest of their life normal. If it's a bigger protrusion, they may expect to have multiple surgeries throughout their life and rely on medication and therapy. So next is a cleft lip or palate, which is an opening or split in the roof of the mouth or lip. So here on a regular ultrasound, again, we can see the eyes, nose, and mouth. And on this ultrasound, you can see the eyes, nose, but there's an indentation in comparison to how this lip sticks out. And then to see it better, on the 3D ultrasound, you can see here the nose, the normal contours between the nose and the mouth. But on this one, you can see the nose, and then there's a clear indentation here. So when this diagnosis is made, the mother can go through a regular delivery, but then the baby will have surgery to get it fixed. Depending on how severe it is, they can have one surgery or they may have to have multiples. And oftentimes they place the scars in the normal contours between the nose and mouth, so oftentimes you can't tell they had surgery to begin with. And last is exomphallos, which is a weakness of the baby's abdominal wall where the umbilical cord joins it. This weakness allows abdominal contents to protrude outside the abdominal cavity. So here's a side profile, again with the gestational sac outline and the fetus, and you can see a clear head and then a rise where the stomach is and the legs. And on this side, we have the gestational sac outline, the head, and then a rise in the stomach, but you can see this large protrusion in the abdomen. So when a mother receives this diagnosis, she will have a C-section again to prevent pushing on the protrusion. And then depending on the size, the baby could have one surgery to have the problem fixed, or they may have to receive multiple to have the problem fixed. All right, so now I'm going to talk about placental localization, which is the localization of the placenta that can be used to diagnose placental abnormalities. So the placenta is basically the lifeline between the mom and the baby. It's made up of fetal arteries and veins and maternal arteries and veins. It's responsible for providing oxygen, nutrients, and getting rid of waste. So common conditions are placenta previa, placental chorioangioma, and abruptio placenta. So placenta previa is when the placenta covers the birth canal. So in this, we have the outline of the gestational sac, and then the placenta attached to the top, and this is the baby. And on this side, we have the outline of the gestational sac, and you can see the placenta is covering what is the cervix as drawn by this line in the birth canal. And this could be very dangerous for the baby and the mother. So this a lot of times increases the risk of postpartum hemorrhages, hysterectomies, hospital durations, blood transfusions. So once this is diagnosed, the mother will have a C-section, and there's a good chance of having a preterm delivery. So placental chorioangioma, which is the most common tumor of the placenta and generally a benign vascular tumor. So again, with the regular, the gestational sac and the placenta attached to the top with the baby here. And here we have the outline of the gestational sac. This is the placenta attached to the top. And here you can see this huge mass attached to the placenta, which is the chorioangioma. Depending on the size, if it's small, the doctors aren't that concerned. They'll just leave it go and she'll have a regular delivery. If it's larger, it's often associated with fetal conditions, preterm delivery, and C-sections. So they'll either have a C-section to save the baby, or they'll try and treat the conditions until the mother delivers. And last is the abruptio placenta, which is interruption of the placenta by partial or complete separation. So the gestational sac outline, placenta at the top, baby here. And on this one, this is the gestational sac outline, the placenta, which has separated from the wall, and here is this black large area, which is actually a retroplacental hemorrhage. And this is a very bad condition for a mother to be in. This often results in pre-infant mortality. So depending on how far along the mother is, they'll either do an emergency C-section or they'll make the mother stay on bed rest until delivery if she's farther along. And next is multiple pregnancies. So ultrasound is relied heavily on to determine the number of fetuses. On average in the United States each year, there's over 133,000 twins, over 4,000 triplets, 228 quadruplets, and 24 quintuplet births or higher multiples. So here we can see twins in early pregnancy. So again, these are the outlines of the gestational sacs with the embryos here. There's two gestational sacs because they don't share a placenta. If they did share a placenta, they would be in the same gestational sac. And then here in later pregnancy, again, we have the two gestational sacs with the two babies seen here. And with any multiples birth, there's always increased risk factors. So growth restrictions, preterm delivery, C-sections. And next is triplets. So here's triplets in early pregnancy, again with the three gestational sacs. And then here, this photo is divided into quadrants. So when you're doing an ultrasound, you can't get side profiles of all the babies once they reach a certain size. So this quadrant is baby 1, baby 2, baby 3, just from different views because they moved the transducer. And in this bottom one, they did get a view of all the babies' heads, as you can see outlined here. And last is quadruplets. So again, we have the 4 gestational sacs with the embryos inside. And this is another view of all of them together, but you can still see the divide between their gestational sacs for not sharing a placenta. Next is hydramnios and oligohydramnios, which pertains to the amount of amniotic fluid surrounding the fetus. So both conditions can have adverse effects on the fetus, such as intrauterine growth retardation, intestinal atresia, hydrops fetalis, or renal dysplasia. So hydramnios is the accumulation of excess amniotic fluid during pregnancy. So remember, fluid is represented by the black on an ultrasound. So here you can see the gestational sac outline. And they're measuring from the top to the bottom. And this is roughly like 18 centimeters. So the normal amniotic fluid index, or AFI, which is the measurement they use for amniotic fluid, is between 5 to 25 centimeters. And then in this one, you can see there's clearly a lot more black on the screen, and the line goes much farther. So for hydramnios to be diagnosed, it's an AFI greater than 25 centimeters. When this is diagnosed, a common treatment is to do an amnio reduction, where they'll take a needle and remove amniotic fluid. And then oligohydramnios, which is a condition characterized by a deficiency of amniotic fluid. So again, we have the normal AFI between 5 to 25 centimeters. And on this ultrasound, you can see there's very little black. So for oligohydramnios to be diagnosed, the AFI has to be less than 5 centimeters. So to treat this, they'll often do an amnio infusion while they insert amniotic fluid. And last is the confirmation of intrauterine death. So 1% of normal uncomplicated pregnancies end in fetal death in utero, or FDIU. Some common signs of FDIU are the gestational sac is larger than 16 millimeters and has no embryo, or an absence of fetal heartbeat and fetal movements. So here on this ultrasound, this is a miscarriage is a spontaneous loss of pregnancy before 20 weeks. So on this ultrasound, we have the confirmed pregnancy with the gestational sac, the embryo, and the yolk sac. And then on this side, you can see the gestational sac is much bigger, but there's no presence of an embryo, so that is a confirmed miscarriage.
Alright, so amniocentesis is a procedure where the amniotic fluid, which is the fluid surrounding the baby, is taken out and is used for multiple things. And as Grace already kind of mentioned, this can be used for if there's too much amniotic fluid, or in cases of parents wanting, like if something kind of concerning was seen on the ultrasound, this is used to kind of confirm or deny if something is going on. So it can be used, the fluid is tested for genetic abnormalities, and such as like sickle cell anemia, cystic fibrosis, and then it can also be tested for chromosomal abnormalities such as Down syndrome. And as I said before, it's like a double check, and it has a very small margin of error. I think it's less than up to 1%, so it's pretty accurate. So dilation and evacuation. So if the fetus, so if the mother is in the second trimester of pregnancy and the fetus has not was not able to survive, this is a procedure that's used where the fetus is extracted from the mother in two parts. So the first part is dilation, where the cervix is dilated using either like a actual physical like dilator or medication where it softens the cervix. And then evacuation is where the fetus is then taken out using multiple instruments and suction. And it happens in the second trimester of pregnancy, so between 13 and 24 weeks. So because of that, it carries multiple risks for the mother, such as damage to the cervix and uterus, and then also it can increase the chance of miscarriages in future pregnancies. If the mother reaches her third trimester and the fetus is determined by the physician that it's not able to survive outside of the womb, then this is what most parents will then turn to is lethal cardiac injection. So this happens from 25 weeks until birth, and what happens is an injection of these three compounds, so one of the three compounds, is injected into the amniotic sac. This will cause the fetus to go into cardiac arrest, and then it will be followed up by DNC. So the fetus is not alive when this happens, and then it's necessary, like I said before, if you need to survive. And because it's happening in the third trimester, it carries even more risks than it's happening later. So something a little different is the ultrasound uses in China. So in China, it's illegal to use ultrasounds for determining of the sex of the baby, but it is legal to use it obviously for health reasons to make sure the baby is growing normally. This is a similar law is passed in India for the same reason. The reason being is that there is a tendency in the culture of like the Chinese and Indian cultures that like sons are looked at more, they're more preferable to females, and because of that, the ratio of males to females in China is very skewed. There's more males and there's less females. So they passed this to hopefully reduce the number of abortions that parents would have when they found out they were having a girl. But I mean, with any law, there's going to be people who try to break it. So women have been, there's been cases where women are sending their blood samples to Hong Kong or Taiwan to be tested for whether or not they're having a boy or a girl. And then there's actually like small villages that are like putting their money together to buy their own secret ultrasound machines to test for the sex determination. So that's kind of interesting, like the different side of ultrasound uses from like America to a different country. So with the use of ultrasound, there are a lot of ethical questions that come up, that can arise from it. So the first one is as you saw with Grace, she showed a lot of different ways that, like a lot of different problems that can arise with pregnancies, and that ultrasound can show. So the question that a lot of people probably think about is, should a woman be forced to abort or terminate her pregnancy if the child was found to have a lot of birth defects or disabilities? And can a fetus feel pain if the mother does decide to terminate the pregnancy? Does the fetus have rights? You know, whether it's in the womb or outside the womb. And also, there's been a lot of cases where anti-abortionists are willing to fund for ultrasound technology because there have been many women who, when they've seen the ultrasound, it kind of changed their mind about having an abortion. So would it be ethical to allow funding for ultrasound technology by anti-abortionists if it's used to persuade women not to have abortion? And then a lot of problems that occur from that is like everybody's going to have like a different response to the ethical problems that I just mentioned. So there are a lot of women who decide to give birth to the child if the ultrasound does show a lot of birth defects. They decide to have the child anyway, and they're criticized because people will say like, oh, you're evil, you're selfish for doing that to your kid. Then on the other side, there's also women who decide not to give birth to the child, to terminate the pregnancy early because of the same reason, because they don't want to have a child born, you know, they don't want to put their child through that. And they're often criticized for the same exact reason. So it's like, with ethics, there's really no right or wrong answer. So there's a lot of problems. So something a little bit different is that there's new innovations in sex determination. So kind of we're going in a direction where you don't really have to rely on ultrasound to figure out if you're a boy or a girl. There's a new thing called Sneak Peek, which is a at-home sex determination test. It's very similar to 23andMe. And in this way, women are able to send in blood samples. They're at the, in the convenience of their own home. They take their own blood, they send it to the lab, and then they get the results fairly quickly. Any questions? Or comments?
When it's like a kind of a graph originating from like a point source, it's like a cone. Is that because you like scan with the transducer like that?
The transducer surface is like, it's curved like that.
Yeah, it has to do with the way the sound is going out.
I don't know if you guys know the answer to this, but the problem that you were saying there's not enough fluid, and so they like add some, do they like take it from someone else, or do they have something synthetic?
I honestly think it would probably be a synthetic.
Yeah, it's because it's a sterile solution, because if it comes from someone else, you have to be worried about antibodies and other things being formed.
Okay, so we're gonna play a game now.
Oh yeah, the word game.
I don't know if any of you guys have ever played fly swatter, but
I've used the fly
okay.
swatter.
So we're gonna divide you into teams,
Oh.
and so it'll be you 5 up here, the back row. You 5 will be on a team, and then you guys will be on a team. So I'm gonna give each team
Oh, geez.
each team a fly swatter and their floral. So
No, it's five. No, I'm out of this. Oh, look at this.
it's literally
Oh,
all
this
they
is cool.
have.
They really are fly swatters.
Yeah. Okay. So
You can beat each other up if you don't like the answer.
So there's 2 rules to this
Sure signed a
game.
liability waiver.
Yeah, we haven't used them. I literally bought
So
them
they
for
say.
this game.
Where's the flutter?
So rule number 1, don't hit each other. Rule number 2, so I guess I should explain how it's played. So you stand this way, and we're gonna read off like a definition of one of the terms we used or a question. You have to wait until the entire question is said, and then you turn around and you wanna try and hit the answer as fast as you can. If you're the first one to hit the answer, you get a point.
On the screen?
Yes.
Oh,
Oh no.
Yeah.
Oh no.
Yeah.
gentle guys, gentle.
Yeah. Okay. And then,
James.
we were doing it yesterday, it was fine. And then the team with the most points will get first picks at the desserts we brought. So,
Wow.
okay.
Yeah, what do we have?
Food's involved.
We've got brownies, cookies, and a different kind of cookie. So,
Are they homemade
It's all
brownies?
very healthy.
yeah.
One
I'm
of
gonna
them's
win.
homemade.
I'm gonna win.
There's an incentive
Okay,
here.
so you 3 with the fly swatters, you're up first.
Oh dear God.
Oh, so it's gonna rotate.
Yeah,
Yeah.
This is gonna
yes,
be good.
everybody has to participate.
All right. Go on up there.
Our teams will help us. Yeah.
Okay.
You got it.
Oh, your team can shout out to you or not?
Oh, yeah, turn that, yep. Is that enough room, or do I need to move?
I think she's
Okay, yeah.
No, okay. Hey, actually, let's turn the lights up.
And remember, you have to wait till the entire question is said, or your point doesn't count, okay?
This is funny. It's fun.
Okay. All right. Okay, so what is the name of the device that produces sound waves that bounce off body tissues and make echoes?
Do we turn around?
Yep.
Oh.
You want to do it as fast as you can.
Oh my god.
Yell it out.
Blue, right?
No, wait.
I'm too tall, my shadow's not there.
Blue, blue, blue. All right.
Yeah, blue.
All right.
James, catch.
What's next?
All right.
Yeah.
We got it on video. We can replay it.
Stop it. Slow motion. Like, oh my God.
Alright, so what is the large cavity of fluid surrounding the embryo?
Right? One down.
Yeah.
Oh god, now I'm gonna mess it up.
That's okay.
If you think it's wrong, just hit all.
Okay.
Just start, yeah.
Just start hitting all of them.
Do you want to get one hit?
All right.
It'll work.
So what does FDIU stand for?
Blue. Don't mess it up. Resident comments.
It's all the pressure's
I
on.
might mess it up.
You guys gotta go quick, come on.
What is the name for an accumulation of excess amniotic fluid during pregnancy?
Go, 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 go.
Go, go, go.
Start hitting
go.
things, start hitting things. Just hit it, hit it. Doesn't matter. Hit it.
This,
No, that's the other one.
Yeah.
It's-
Which
yeah,
one?
The green.
Hey.
Yeah.
Sorry, guys.
yeah, I don't.
Go for it.
That girl had senses on the
We may be 2 down, but we're catching up. Oh, and I'm next, shoot.
So what is the name of a birth defect in which a developing baby's spinal cord fails to develop properly?
Top middle. Top middle.
Hey, I thought we were supposed to help each other, you know?
Yeah.
I know we're not supposed to do that kind of stuff, you know?
Y'all are really.
I really want a brownie, you know? All right, let's go. We just have to work our way through all.
Yeah, you're brilliant.
A miscarriage is a spontaneous loss of pregnancy before how many weeks?
B.
Yeah.
Alright, Blue's got 4 points.
Oh,
You guys got
It's
1.
all good.
Purple's got 1.
Well, yeah, each.
Oh.
It's not competition, but we're winning.
Very intense competition.
Okay,
This one's easy.
what does D&E stand for?
I just saw
Blue.
It's like, we have the worst part.
It's like not even fair.
What is the amniotic fluid index, or AFI, for hydrogenous?
Yeah, you're right.
Yo. Somebody's got the 6th sense going.
I think he's scouting it.
We're waiting for the answer.
All right. How many quintuplet or higher multiple births occur each year in the U.S.?
Can't reach it.
But you knew it.
I didn't know.
Which one got that one?
That was purple.
Oh, purple's catching up. Yeah. We're down by 1. But we're okay.
Alright, what is the name for when a placenta covers the birth canal?
Top right. Top right.
What? I don't know.
Right.
No, that's not it.
Come on,
Top left.
Purple.
Oh.
Thanks.
Thanks.
Whoa.
Would you have known it anyway?
Sorry.
No,
Okay,
I.
then.
Non-magical base.
Okay. Give me 1.
With it underdog.
Okay. Who attempted to detect brain tumors and other abnormalities while patients were partially submerged in water?
That
I'd say
was a
green.
try.
Okay. At least you're
Yo,
honest.
no.
You got it.
You got it.
Oh, okay.
Yeah, I told it was you.
Oh, okay. I heard drawn, I was like,
You're welcome.
that ain't right.
What is the name for when a baby is born with an undeveloped brain and incomplete skull?
Ninja.
Got this, James. You got this, James.
Don't help them out.
Stop,
Don't help them out. You're right.
Go on.
Age and is used to determine duty.
And it's purple. This is the last one.
It's gotta be. There's 3 left.
This one's worth 10 points. All or nothing.
All right, what is the name for the condition characterized by a deficiency of amniotic fluid? You're right. Blue. That was a light tap.
All right. Quick, we gotta get the
Purple 1 though.
Dang it.
All right, so purple, you get first picks. Who can, oh, blue.
Yeah, blue is the second.
All right, purple team.
Wow.
You guys,
21 grams of sugar in
I was
this.
gonna say you guys.
Oh my God.
That's my for today.
Not until everybody's